What's happening, folks? Doc Free coming back to you again with another health education lesson, and today we're discussing medication safety. So, we all get issued medication for different reasons. It could be to treat a chronic disease, manage an illness, even for stress relief. But we want to make sure that whatever we're getting our medications for, we're taking it properly. So whenever you receive a prescription, you should receive a medication list, which has all the active ingredients on it, including your warnings or side effects. So if something says that it causes dizziness or drowsiness, even nausea, we want to make sure that we're not operating any heavy machinery, including your vehicle. In other words, we might want to stay home and just let the medication kick in and at least get a baseline on how it affects you so you don't accidentally put yourself in harm's way or anyone else. Also, we want to make sure that we're taking our medication as prescribed. So if it's issued for a back issue, we probably shouldn't be using it to treat our ankle. If there's anything else you need from your provider or maybe even an increased dosage, you want to go back and revisit the issue with your provider. Just some quick stats. Roughly about 80% of Americans have at least one active prescription in the system, and about 30% have 5 or more. So that's a lot of medication out there. So I want to throw out about 5 tips just to make sure that we keep ourselves safe as well as our loved ones. The first one, out of sight, out of mind. We want to make sure that our medications are stored properly, up high and out of the way. So you can put it in your medicine cabinet, that shouldn't be a problem, but you want to make sure that the young folks or the little ones can't get to it. So, perspective. If you have a 2-year-old or under, AKA a COVID baby, they're built differently. So that little safety cap on top, she may not work that well. So you want to make sure that they can't get to it, just to make sure everyone is safe. With that much medication out there, we want to make sure that we do not remove the labels. One would assume that's great for discretion, that you could put it again in your medicine cabinet, and if you have guests over, they can't really pinpoint what it is. But it's an easy way to confuse yourself and then also others. So we want to leave the labels intact. And if you need to safeguard it in your room or put it behind, I would say closed doors, but somewhere more secluded, I would highly advise that before removing labels. Tip number 3, a lot of folks don't know that you can call your pharmacist or your provider to return any unused medication. We don't want to flush it down the toilet and we don't want to throw it in the regular kitchen trash. We want to make sure we go back to our providers so they can dispose of it properly, and then also it doesn't end up in the wrong hands. We want to make sure that we're completing all medications cycles or series. So if you go to the ER and they prescribe you 12 days of medication, you want to make sure that you're taking the full 12 days to ensure that whatever issue or matter that you're there to be treated for is actually taken care of, and making sure that your body has recovered sufficiently so that the illness does not come back. And lastly, sharing is not caring. Now, we all know what it's like to go to your aunt's house who got some medication left over for the last 10 years and you use it for something else. We don't want to do that. So make sure that whatever medication is prescribed to you is just for you. Other than that, you have a great day and be blessed. All right, y'all.